Alright, so this is for Mrs. Phillips that presented to the emergency room for a severe headache. She's 43 years old and she has a 7 out of 10 pain. So as I enter her room, I'm going to make sure that the board is up to date, make sure that there's no tripping hazards to the bathroom, make sure that she has a name band on. I'm going to assess if she has any lines such as feeding tubes, trachs, oxygen, IV lines, but she doesn't have any of those. Her assistive devices are within reach. Her bed's all the way down. No railings are being used. So I'm going to come in the room, wash my hands, provide privacy for the patient, introduce myself. Hi, Mrs. Phillips. My name's Wyatt. I'm going to be your nurse for today. And I'm going to do a physical assessment on you to see what brought you here today. So first I would take pen light and assess pupils, make sure that they are reactive, equal, round, especially with a headache or other neurological problems. That's a good sign to look for. We're going to check for any JVD. With possible hypertension, might have some JVD showing. Then we're going to go and look for her strength in her hands. So can you squeeze my fingers? So they're equal. Can you push my hands away and pull them back towards yourself? Alright. And then we have equal pulses, and we have a cap refill of less than 3 seconds. Don't fall down. So getting the lung sounds here. Okay. And okay, lung sounds are clear and equal on the front and the side. And on the back here. Yep. And 10. And also in the back, lung sounds are all clear. Then we'll listen to her heart. Noting S1 and S2 for 60 seconds. Then we will do bell sounds. And bell sounds are present in all 4 quadrants. Palpate any tenderness or distension. Can you tell me the last time you had a bowel movement? And on urination, do you have any burning or any frequency issues? Okay, so moving down to the feet, we're going to check cap refill again, check pulses again, they're equal, bilateral. We're going to test motor and function, so can you feel me touching your feet? Can you push your toes forwards and then pull them back towards yourself? So that's equal as well. So we'll get a set of vitals, and then we will tell the next person on shift what we have going on here. So this is Mrs. Phillips. She presented with a severe headache that wouldn't go away after she used over-the-counter medications. Her initial blood pressure was 216/108. Heart rate of 92, respiratory rate of 20, and then temperature of 36.9 Celsius. SpO2 was 96. So we got 2 large bore IVs going, and we started her on some vasodilators, which was, if I can find it here, there we go, metoprolol and hydrazoline. So we got that started. Her blood pressure didn't go down much. It only went down to 204/102. Her pain was still very high in her headache, and her heart rate stayed a little bit elevated, and her SpO2 decreased some. When we took some labs, her glucose was elevated, her hemoglobin was elevated. So we actually got her up to the ICU, and in the ICU they found that she had some right-sided weakness and facial drooping. So we had a CT scan that showed a hematoma in her brain. So she was put as a stroke protocol, and she's in the ICU. After we got that evacuated, she was discharged with home vasodilators. Other than that, she has been assessed and taken care of.